Rachel, just some questions about your special interest in lifestyle medicine and how that sort of translates into a regular general practice. How important is the use of lifestyle as medicine in your practice, and what does that look like within a regular general practice consultation?
Look, I really see lifestyle medicine as the cornerstone of helping to deliver good health and well-being to people, really irrespective of what their presentation is to me in the surgery. I do really bring lifestyle concepts into virtually every consultation that I have. Lifestyle medicine as a specialty really is anchored around 6 key pillars. Diet and nutrition being a really big one, exercise and movement in the sense of not just gym type exercise, but also avoiding long periods of being very sedentary. Sleep quality and adequate duration, stress management, and how that connects also with mental health, social connectedness, the 5th pillar being actually having a sense of meaning and purpose and knowing your own place in the world, so to speak. And then the 6th pillar being an awareness of substance use, obviously alcohol, nicotine, but increasingly I'm also finding scope to ask people about other sort of addictive behaviours, including things like gambling and pornography and doom scrolling on social media and the like. So really lifestyle, you can understand around those pillars where suboptimal lifestyle habits and behaviours can often be one of the elements that contribute into someone's presentation of illness, and that may vary sort of from obviously acute presentations, maybe not so much of an issue, but almost anything that is of chronic nature, be that metabolic disease, hormone dysfunction, mental health, anxiety, that there is always a lifestyle component that may be contributing into that presentation. But I also find it's a really powerful tool to help empower someone in their own self-management and self-efficacy to be able to take charge of their own health and to make some changes that can help in the management of that health problem as well. So I think at its interface, bringing lifestyle into the general practice consultation, firstly just requires the understanding of its importance in someone's whole health picture. I find myself asking a lot of questions, just raising those thoughts in someone else's mind. Something that I've found very empowering as a clinician is to actually see myself more as the coach and or the guide in helping someone through their health journey, rather than myself as the guru or the expert, which puts a lot of pressure on a GP to have all the answers for somebody. Actually, I recognise that people themselves are the expert in their own health and in what really matters to them and what they value, and it also gives me the opportunity to help understand what priorities and what values do they have, which will help kind of motivate some of the changes that I would be encouraging them to do. So, sorry, you might.
So how would you, for instance, in a regular, how would you have that conversation with a patient about their sort of diet and exercise and things? How would you go about that in a regular consultation?
So obviously allowing them the chance to speak and listening to what their particular issues and concerns might be, but then I have a very systematic way of running through some key questions. So I do ask, look, are you able to talk me through on an average day, what kind of food choices are you making? What's your breakfast? What's your lunch? What's your dinner? What are you snacking? Beverages, coffees, alcohol. Do you have any digestive symptoms? Obviously gut health and IBS, bloating, gut symptoms being a key part of how, again, the effect of someone's lifestyle and diet, but also an area where they may or may not be motivated and or sort of confident to make some of those lifestyle changes. What sort of exercise do you do on a regular basis? What's your job? Are you sitting at a desk? Do you have a standing desk? Are you getting some fresh air and some sunshine? Do you have a dog or a pet, something that's keeping you outdoors and exercising regularly? What's your average bedtime? Are you falling asleep straight away, or are you lying, tossing and turning? Is that sleep consistent through the night? Are you waking refreshed, or is it disturbed and disrupted? What's disturbing you? Is it bladder habits? Is it overheating? Is it anxiety, stress, mental sort of, churning thoughts that are waking you and disturbing you? And I do often find in just the exploration of those questions that people will start to identify for themselves a lot of the aspects that maybe they've just been on autopilot, in the busyness of life, they've just fallen into bad habits, and they'll often be picking themselves up on saying, actually, can't remember the last time I got out for a walk, or I always feel great when I do go and spend an afternoon in the park, but I just can't remember the last time I've done that. And it's often by just asking the people the questions themselves that they'll get that self-revelation, and then I can come in and perhaps use some of my knowledge and the expertise and the tools to help guide them in a decision-making, action planning process of how will they set up and structure something differently to actually be able to make some changes going out of the consultation room.
And that's one patient at a time, one consultation at a time. What do you see do you see as a future in terms of group medicine, group consultations?
Yeah, look, I would love to be able to scale this concept to be able to increase the reach and the efficiency of spreading this lifestyle message much more broadly. Obviously, over time, look, I've been able to develop a whole suite of templates and tools that I do use and individualize to specific patients. And I love the fact that general practice is so community, family oriented, and we do have a wonderful cohort of patients here who are generational, grandparents, parents, children, and even I think we have a few families with great grandparents who are all patients in the practice. And we do see that ripple effect that educating a parent does flow on to sometimes what their parent, the grandparent, and obviously what their children are doing. Beyond that though, I do foresee a possibility to also be setting up what we call shared medical appointments and group workshops and masterclasses. And I guess the concept here is to be able to bring together a group of people who may be struggling with the same sorts of health concerns. Metabolic syndrome, overweight and obesity, pre-diabetes, prenatal or preconception optimization, mental health, the hyper-aroused anxious sort of presentation. These are all the sorts of situations that in general practice we see all the time. And if the opportunity to bring a group of people together, obviously with their consent and collaboration, and to be able to have a group consultation with these individuals, not only leveraging the expertise of the GP who is running the session, but also creating the sense of collaboration and community and accountability, and helping people in their busy lives and in their health stresses to know that they're not alone, that there are people walking through the same sorts of journeys, and bringing that sense of accountability, inspiration, mentoring, and potentially even, springing off into that sort of ongoing accountability and group support for them to be toward themselves, with community groups, coffee catch-ups, city to surf teams forming, and essentially working towards a brighter and a healthier future together.
Thanks so much, Rachel.